A high phytate content diet includes foods rich in phytic acid, primarily found in plant-based foods like grains, seeds, legumes, and nuts. Phytate, or phytic acid, is the storage form of phosphorus in these foods and has some health implications. Common sources of phytates: 1. Whole grains, e.g. wheat, rice bran, barley, oats. 2. Legumes, e.g. beans, lentils, chickpeas. 3. Nuts and seeds, e.g. almonds, walnuts, sunflower seeds. 4. Soy products, e.g. tofu, soybeans. 5. Unrefined flours, e.g. whole wheat flour. Effects of phytates. Anti-nutrient properties. Phytic acid can bind minerals like iron, zinc, calcium, and magnesium, reducing their absorption in the digestive tract. This can lead to deficiencies, especially if these minerals are not consumed in adequate amounts. Potential health benefits. Despite the anti-nutrient effects, phytates have antioxidant properties and may help in reducing the risk of certain chronic diseases, such as cardiovascular diseases, type 2 diabetes, and cancer. Managing phytate intake. Soaking, sprouting, or fermenting grains and legumes can reduce phytate content and improve the bioavailability of minerals. Diverse diet, including a variety of foods and sources of nutrients, can offset the potential mineral binding effects of a high phytate diet. Vitamin C-rich foods. Consuming foods high in vitamin C alongside phytate-rich foods can enhance iron absorption. A diet high in phytates can be a part of a healthy eating pattern, especially if measures are taken to optimize nutrient absorption. A diet high in phytate, phytic acid, has both benefits and potential drawbacks. Here's a breakdown of each. Benefits of a high phytate diet. 1. Antioxidant properties. Phytates have antioxidant properties, which help neutralize free radicals and may reduce the risk of chronic conditions like cardiovascular diseases and certain cancers. 2. Anti-inflammatory effects. Phytates may have anti-inflammatory properties, potentially helping to lower markers of inflammation in the body. 3. Lower risk of kidney stones. Phytates can inhibit the formation of calcium oxalate crystals, which are responsible for the most common type of kidney stones. Thus, a diet rich in phytates may help prevent kidney stones. 4. Blood sugar regulation. Phytates may help in regulating blood sugar levels by slowing down the digestion of carbohydrates, which can prevent spikes in blood sugar after meals. 5. Potential role in bone health. Although they bind calcium, some research suggests that the regular intake of phytates may have a protective effect on bones, possibly by reducing bone resorption and the risk of osteoporosis. Hazards of a high phytate diet. 1. Reduced mineral absorption. Phytates can bind to essential minerals like iron, zinc, calcium, and magnesium, forming insoluble complexes that the body cannot absorb. This can potentially lead to deficiencies, particularly in diets where these minerals are already limited, e.g., vegetarian or vegan diets. 2. Risk of iron deficiency anemia. In populations that rely heavily on grains and legumes as their main dietary staples, the phytate content can interfere with iron absorption, leading to iron deficiency anemia, especially in vulnerable groups like pregnant women, children, and the elderly. 3. Digestive discomfort. Some people may experience digestive discomfort, such as bloating and gas, when consuming large amounts of phytate-rich foods, especially if they are not used to a high-fiber diet. 4. Possible interaction with protein digestion. Phytates can also bind to proteins, which may reduce the digestibility of some plant-based proteins. This effect is more prominent when phytate levels are particularly high. Overall considerations: moderation and balance. Including a variety of food groups and taking steps to reduce phytate levels, e.g., soaking, sprouting, or fermenting foods, can help balance the benefits and potential downsides. Specific needs. The impact of a high phytate diet varies based on individual health status, dietary patterns, and overall nutrient intake. People with specific mineral deficiencies may need to pay closer attention to their phytate intake. A high phytate diet can be beneficial in the context of a well-rounded, balanced diet, but requires careful consideration in populations at risk of mineral deficiencies. Phytates, or phytic acid, may have certain roles in the management of rheumatic diseases due to their antioxidant and anti-inflammatory properties. While more research is needed to fully understand their impact, here are some ways a diet rich in phytates might influence rheumatic conditions. 1. Antioxidant effects. Protection against oxidative stress. Rheumatic diseases like rheumatoid arthritis, RA, and osteoarthritis, OA, are often associated with increased oxidative stress, which can contribute to inflammation and joint damage. The antioxidant properties of phytates can help reduce oxidative damage to cells and tissues, potentially alleviating some of the inflammatory processes in these conditions. Reduction of inflammation. Phytates may help lower levels of pro-inflammatory markers, such as interleukins and tumor necrosis factor alpha, TNF-alpha, which are often elevated in rheumatic diseases like RA. Ta-2. Bone health and prevention of osteoporosis. Possible protective role for bone density. Some studies suggest that a moderate intake of phytates could help maintain bone density and reduce the risk of osteoporosis, which is a concern in patients with certain rheumatic conditions like RA and systemic lupus erythematosus, LE. Phytates might help by reducing the rate of bone resorption, reduction of calcium loss. While phytates can bind to calcium and reduce its absorption, they may also help prevent excessive calcium loss in urine, which could be beneficial for bone health in the long term. 3. Anti-inflammatory potential. Management of chronic inflammation. Chronic inflammation is a hallmark of many rheumatic diseases. Phytates' ability to inhibit certain enzymes and inflammatory pathways may make them useful as part of an anti-inflammatory diet. Complementary to anti-inflammatory diets. In conditions like RA, where diets rich in omega-3 fatty acids and antioxidants are recommended, incorporating phytate-rich foods like whole grains, nuts, and seeds may add to the overall anti-inflammatory effect. 4. Potential role in pain management, reducing joint pain. By decreasing inflammation and oxidative stress, phytates might indirectly contribute to a reduction in pain and stiffness associated with rheumatic diseases, although this effect is generally more subtle compared to pharmaceutical interventions. Complementary therapy. Phytate-rich diets can be used alongside other dietary strategies, like the Mediterranean diet, to support overall health in rheumatic patients, potentially helping to manage symptoms over time. 5. Prevention of comorbidities. Cardiovascular health. Patients with rheumatic conditions, particularly RA, are at increased risk for cardiovascular diseases. The antioxidant and cholesterol-lowering effects of a diet rich in phytates may help reduce this risk. Blood sugar control. Phytate's ability to improve glycemic control may be beneficial for patients with type 2 diabetes, which can sometimes coexist with conditions like gout or metabolic arthritis. Considerations in use. Balancing mineral intake. Since phytates can inhibit the absorption of minerals like zinc, magnesium, and iron, patients with rheumatic diseases need to ensure adequate intake of these nutrients to avoid potential deficiencies. Individualized dietary plans. The inclusion of phytate-rich foods should be tailored based on the patient's overall dietary habits, needs, and any specific deficiencies. While a diet high in phytates may offer some supportive benefits in managing rheumatic diseases, it is typically one component of a broader nutritional strategy. It's best to consult with a dietitian or healthcare professional to develop a balanced diet that supports the needs of patients with rheumatic conditions.